The following are features of the right lung. The following are features of the right lung. A, normally has 3 lobes and 2 fissures. That is actually true. So your right lung, you actually have the 3 lobes and right fissure and 2 fissures. A horizontal fissure that will be within the what? That will actually be within the 4th intercostal space, and then the oblique fissure that will actually be within the what? The 6th intercostal space and the 6th rib, remember. Right, and these fissures, they actually meet in the anterior axillary line. Right, done. Here's a cardiac notch and a lingula. Here's a cardiac notch and a lingula. That is false. That is false. Right? So that's for the what? For the left lung. So remember the left lung is a superior and inferior lobe, and the lingula and the cardiac notch, they actually lie in the superior lobe, not the inferior lobe. C is an impression of the azygous vein over its hilum. Is an impression of an azygous vein over its hilum. What do you think? Right. So if you remember from the course of the azygous vein, right, it's actually going to end by draining into the superior vena cava. So since the azygous vein is on the right, so it's actually form a groove as it will be draining into the inferior vena cava. That will be like over the right lung hilum. D, sits on a lower level on the diaphragm. That is true, right? So you have your right lung sitting on the what? On the diaphragm. And remember, the right lung is actually higher than the left lung, larger than the left lung. Oh, that's question C. So it's relatively larger and higher. Why is it higher than the left lung? Right, that is actually because of the right dome of your liver, the right lobe of the liver being larger than the left lobe of the liver. So that makes, if you remember, that makes the right lung to be higher than the left lung, and also it makes the right dome of the diaphragm to be higher than the left dome. So the right dome of the diaphragm will actually end at the superior border of the 5th rib, and then the left dome of the diaphragm will actually sits on the lower border of the 5th rib. Done. Question 12. The following are contents of the posterior mediastinum. The following are contents of the posterior mediastinum. A, thoracic duct. That is true. B, the azygous vein. That is true. C, the heart. That is false. Actually, the heart sits in the mediastinum, right? In the inferior mediastinum, right? Mediastinum. D, the sympathetic trunk. That is true. Right, just a quick mnemonic to just get the structures of the posterior mediastinum. We use the mnemonic DATES, D-A-T-E-S. D, the descending aorta. A, the azygous vein. T, the thoracic duct. E, the esophagus. S, the sympathetic trunk. DATES. You get it? So DATES, posterior mediastinum, you are done. The following are true and typical ribs. The following are true and typical ribs. Rib number 1. All right, so true ribs, we have rib number 1 to 7. These are ribs that actually have their costal cartilages attaching to the lateral margin of the sternum. Then typical ribs, these are ribs, that is rib number 3. Some texts actually involve rib number 2, right? But we have rib number 3 to rib number 9. A typical rib number 1, rib number 2, rib number 10, rib number 11, rib number 12. Those are your atypical. So you want it true and typical. So let's go. Rib number 1. That is false. Though it is a true rib, it's not a typical rib. Rib number 2. False. Though it is a true rib, it is not a typical rib. Rib number 3. True. It is both a typical rib and a true rib. Rib number 6. True. Because it's both a true and a typical rib. Rib number 11. That is false. You understand? So rib number 1, rib number 2, rib number 10, 11, 12 are typical. You understand? Good.